Astym is a form of manual therapy that we do here at the clinic. It's a form of soft tissue mobilization that we use with tools and instruments to help improve soft tissue mobility, improve pain, improve mobility in through a specific limb. Anything from Achilles tendinopathy, lateral epicondylitis, golfer's elbow, rotator cuff tendinopathy, low back pain, cervical pain. There's a number of different ways that we can integrate it. A lot of times when we try to decide on whether to use the Astym treatment or not is usually through the subjective history, what we hear from our patients. Usually they'll have sometimes complaints of pain after an activity, such as those that have patellar tendonitis or some sort of chronic, long-standing injury into the bony prominences or where the tendon inserts into that bony prominence. Those are the big areas that we usually will utilize Astym treatment. So when we're applying the tools to the tissue, a lot of time we're trying to reestablish the inflammatory response into the tissues. And so along with that, we have some increased blood flow to those tissues, and we have some good inflammatory cells that can help change some of the collagen tissue that's in and around either the tendon or the joint or even the muscle belly. With the Astym treatment, our first and foremost goal is always patient comfort, but we do set the expectation that there might be a little bit of discomfort during the application into some sensitive areas. And understanding that with that treatment, a lot of times they will have, in the end, improved mobility and reduced pain after the treatment. Sometimes they might even have a little bit of redness in and around the area, which is completely normal. I've had a personal experience with it. In the time that I was training for my first marathon, I had developed a bout of Achilles tendinopathy in through my left side, and I was almost 6 weeks out from my race. I was able to integrate some of the treatment into my own care and was able to finish that marathon within 6 weeks later.